Hi, I'm Katie Rietta, and I am a clinical trainer with DermaSpark Products, Inc. And I am here today to demonstrate one of the product lines that we carry, and that's the Dermaroller brand from Germany. And today we're going to demonstrate the eDermaStamp that we use for microneedling treatments, otherwise known as CIT, or Collagen Induction Therapy. So this is basically how we prepare our tray. We have our machine here. We have a barrier film on it. What I personally like to do is put an Axel wipe or a Virox wipe, some kind of sanitation wipe, benzoyl peroxide based on here to put my handpiece on. And 70% alcohol is what we're going to be using today. So right now I'm going to numb our client, and I'm going to be using a 5% lanacine product. So I'm just going to go a nice layer, get a little bit closer to the eye. Always ask your client to keep their eyes closed. And then after we wipe the numbing compound off, we are going to clean the skin and disinfect it before treatment. So right now I'm going to wipe all the numbing cream off. We've let it set for about 20 minutes. And then I am going to clean his skin. I use 70% alcohol to clean to make sure that it's germ-free. Before my client comes in, I pre-soak I'm going to put a little bit more here, my gauze with alcohol. And it's a little fumey, so I'm just going to give it a little bit of a rest before I start to wipe him with it. And you just want to make sure that the skin is well sanitized before treatment. We set our settings to 150. So I'm going to put my tip on my machine. You can see here, there's a little hole in the side. What that was designed for if someone's doing PRP. Plasma is very runny. It's very hard to apply to the tissue. So a lot of times in physician offices, they like to use this particular tip for platelet-enriched plasma treatments. So they're incorporating the microneedling with the plasma, and they can just syringe it into here and work it into the skin, which is a fabulous way of applying it. So not only are they going to have the benefits of the plasma, but they're also going to have the benefits of the CIT, the Collagen Induction Therapy. And they're going to be able to, with this particular needle, break down scar tissue. So now we're going to apply our hyaluron product to this. And again, there's a lot of clinics out there, and they're doing vitamins and all kinds of cocktails when they're doing this. And I would really caution, I would tell people actually not to do it. Forget about the caution, don't do it. You can end up with granulomas, and if you're entering product into the dermis that shouldn't be there, you can end up having a very strong adverse effect. So caution has to be taken when you're doing these microneedling treatments. You cannot just put anything on the skin. This is a very high quality hyaluron. So we're trying to use product that is going to not cause any issue for us whatsoever, and is going to make the client much more comfortable. When I'm doing the treatments, when I first start, I like to, because we just wiped off the numbing cream, so the client's nice and numb, I like to do all the finer areas, the more, if we can say painful, the more sensitive areas first, because they're nice and numb, and so I want to do it while the numbing cream is in strong effect. The cheek and everything, you almost don't even need it because it's very, very comfortable. So I'm going to put this down. I like to put a Virox sheet on my machine, so I'm putting something down here. If I have to put something down, it's on something that's nice and clean, and I don't have to worry about cross-contamination. And I'm always using this, I'm always just alcoholing myself during the process. These swabs that I'm going to be using just to pull back on the tissue are soaked in alcohol as well. So now we're going to adjust our handpiece here for different depths. This has a scale on it, so you can be very exact. So the face has different depths, and every person, of course, has a different depth of skin. And what we're looking for is just a very small pinpoint to know that we're at the depth that we need to be. So I'm going to be very conservative here today, and I'm going to start at 0.3, which is very shallow, but I'd always rather be safe than sorry. And then we work up in increments of 0.1 until we get the desired effect. So typically around the forehead, I might be doing roughly maybe 0.5, on the eye area 0.4, nose maybe 0.3, 0.4, because it's more above the bony area. Around the lip area, maybe 0.7, 0.8. It really depends on the person. And usually if you're going to be doing scar reduction, you're going to be looking at significantly deeper. You're going to have to be breaking down that scar tissue. So you're going to be using probably 1 millimeter and deeper, up to 1.5, depending on the type of scar. So with this, you can, with the scale, we can adjust it to whatever the needs the clients have, and don't overtreat areas that don't have to be overtreated. Now, to get my machine going, I'm going to be using my foot switch here. And the reason why we use the foot switch is to prevent any kind of cross-contamination. So I can just simply turn it off and on when I'm doing the treatment, and I'm not going to be touching anything and perhaps contaminating anything by accident. So I just sort of spread my hyaluron here, and I'm going to start my machine, and I'm just going to do a little swirl. I don't spend a lot of time there. I just want to see if I get any spotting. And a lot of times when you're doing these kinds of treatments, it takes like a minute or so for the skin to respond. And not only that, if I'm continuing just to swirl in the hyaluron, I don't even see this pinpointing because I'm just blending it into the hyaluronic product. So I want to just stay there for a second and see if I'm going to have any pinpoint. And it looks pretty tame there. So I'm going to go up by 0.1 millimeter. So I'm just always pulling at the skin as well. Are you comfortable, Shlomi? Mm-hmm. And I'm going to go like this, and all of a sudden I see a few spots there. And I see some pinpointing. And again, we're just looking, I don't want a profuse amount of blood. Normally I don't allow it to pool at all. I just sort of blend it back into my hyaluron. I just use this as a mixing brush, so to speak. And I think we're good. I can do the rest of his forehead at this, because again, we're just looking for pinpoint, and that's the level. Now, pulling on the skin always makes the client more comfortable, and it also makes it just a smoother glide on the tissue. So when we're doing CIT treatment, it's not just anti-wrinkle or breaking down scars. It's actually sort of engaging the tissue in a very different way. We're not killing any tissue. We're keeping all the cells alive. We're causing a lot of blood to come to the area. We're causing growth factors to happen. So there's a lot of wonderful things that happen in the dermis because of this treatment. So I'm going to go around the under eye, which is it's a little bit trickier. I'm going to keep it quite shallow down here. And he has a little bit of vascular here, so he may have some bruising. I still want to go in a little bit because he has a little bit of lines underneath his eyes that I would like to correct and work on. So I'm going to pull it down as far as I can. You always have to stay outside the bone, so I'm sort of feeling it here. And I'm just going to go in here for a little bit and try to get right in the eye area without getting into the socket area. So he has no major concern on the upper lip, so I'm going to skip that today. I'm going to work down on his nasolabial area here though, and down along the under part of along his jaw here and underneath his mouth. Now here, he's not pinpointing a whole lot. So what I might just do is raise it. I'm going to raise it up and see if I can get some more spotting here. And I just wanted to wait a second to see what his skin's going to do. And I could probably go up one more. Right now I'm at 0.8. So we went from 0.5 to about 0.4, then about 0.6, and now we're going to be at 0.8. So it just goes to show the different depths And now I see some pinpointing, so that's great. Now I'm just going to go over, when I see pinpointing like this, what I do is I just sort of blend it in with my hyaluron, so it just looks like pink hyaluron. I don't want the spotting to occur, and I sort of just like to use that growth factor. It'll just absorb back into the skin after. Now I'm going to do the cheek area. The cheek is always deeper, and if you were going to be doing scar reduction, a lot of people have had past trauma on their skin, acne scars, any kind of injury, and you typically for those types of treatments have to do at least to 1 millimeter and up in that area. And what you should be looking for is not just the pinpoint bleeding. At the end, he should look like he just has a really nice even sunburn. So now we're going to mask him, and we have a mask from Dermaroller, and what it contains is basically hyaluronic acid and small amounts of matrixyl, and we're going to just put this on the skin and let it set for 20 minutes. And what that is going to do, it's going to keep the skin hydrated because the skin has been broken, and we want to keep it air-free, and it gives the skin time to close. So I don't particularly want to wipe the skin. I normally just blend the little droplets with my tip into the hyaluron, and then we put the mask on afterwards. Now if you're using a neck, because this has a lot of product in it, I often put this on the neck because I don't like wasting anything. And then we're going to put the silk side down, plastic side up. We're going to apply like this on his face. And then we're going to take the plastic off. And this is going to make the client feel immediately more comfortable. It's very soothing, this mask. A lot of other clinics use it for post-care for Fraxel or any other microablative type of treatment. So we're just going to layer this on the skin like this. And in 20 minutes, his redness will have subsided literally by, I would say, close to 80%. So 20 minutes has passed, and my client is ready to have his big reveal. And I'm going to just remove the mask. And you can see now there's a huge difference. His skin is calmed right down. Everything has been reabsorbed back into his skin, and he looks a lot better.